This video is about sections 10.2, 10.3, and 10.4 in your Anatomy and Physiology textbook. This video is going to be a bit longer than usual, but I wanted to get all of the upper body all together in one video for you guys. This video is going to be a little bit different. I'm going to point out the important muscles, the ones that I think you really should be familiar with. I am not going to read every slide to you guys. I could, and this video would take a very, very, very long time, and I don't think you guys would watch it anyway. So I'm going to point out the muscles that I think are most important for you guys to know, and I'll leave the rest of them for you guys to read at your own pace and in the style that you guys prefer to learn. So starting with the muscles of the head and neck, muscles of the head and neck are really important because they allow us to produce all of our facial expressions and also allow for chewing and swallowing. When we move into the neck, those muscles allow for you to turn your head. And we'll be talking about the attachments, how these muscles interact with the skeletal system, the actions, the movement, and the innervation, what nerves allow these muscles to get the signals to move. So when we talk about the muscles of facial expression, we're talking about muscles that attach to the dermis or skin and the subcutaneous tissues that are directly underneath the skin. When we tense the skin, we produce facial expressions. So moving our skin to be tighter or looser literally gives us the different facial expressions that we have. Generally speaking, the muscles that are used in facial expressions are innervated by cranial nerve 7, which is called the facial nerve. When we have some sort of paralysis going on, it can cause the face to sag. This is one of the symptoms of a stroke, in fact. The muscles involved in facial expression are all places that you can touch on your face, from your scalp to your forehead, and then of course around your eyes, nose, and mouth, and down into the neck. Okay, so we have some important muscles here, and again, remember we're looking at the superficial on this side, and then for the deep muscles, imagine some of the superficial muscles have been cut away. Okay, so the frontalis, this would be just under the frontal bone here. This one is going to allow you to raise and lower your eyelids. If you can move these muscles independent of each other, some people can and some people can't, you can raise or lower one eyebrow at a time. Your orbicularis oculi, these are what allow you to squint. Okay, some of these muscles here, zygomaticus major, zygomaticus minor, are going to be involved in smiling and moving the mouth. We have another kind of round sphincter type muscle here, the orbicularis oris, that's going to be around your mouth there. The masseter is very, very important, not so much for facial expression, so we'll talk about it more in a little bit, but the masseter is the strong muscle in your cheek that allows you to chew. Nasalis, over the nasal bone, that's going to allow you to move your nose a little bit. And looking from the side view here, we can see the temporalis. That's going to allow a little bit of motion through your scalp. We have some of the muscles involved in your neck that are pointed out here. And here again, some of the muscles involved in smiling and that big masseter muscle that we'll be talking about more when we talk about chewing. Okay, so now we're on to chewing and swallowing. We have some extrinsic muscles in the tongue and also some intrinsic muscles for the tongue. The tongue is surprisingly agile. It can do a lot of different motions. Your tongue is crucially important in speaking. If a person were to severely injure their tongue, they're almost impossible to speak after that. Your tongue is also involved in your digestive system because it pushes food around in your mouth for chewing and also pushes food into the pharynx for swallowing. So the intrinsic muscles of the tongue, we have fascicles. Remember, a fascicle is a group of muscle fibers, okay? And they go vertically up and down in your tongue, transverse across the flat surface, and longitudinally from front and back. So you might remember a little while ago we talked about muscles that antagonize each other, okay? And this is a really good example of that. We have pairs of muscles that allow the mandible, your jaw, to lower or depress, and then elevate to bite or grind. Okay, so this is an example of those antagonizing muscles. Your jaw can move up and down. It can also move back and forth. Okay. The muscles that allow for this are the temporalis. We talked about that one. It's kind of on the side of your skull. The masseter is the big one in your cheek. Also, the medial pterygoid and the lateral pterygoid do this. The mandibular nerve is one branch of cranial nerve 5 that allows for chewing to happen and your jaw to move. Okay, and down into your throat, we have things more involved in swallowing than chewing per se. Okay, so the hyoid muscles, specifically the suprahyoid group. Okay, so here is your suprahyoid group. Okay, the digastric. Okay, these are the muscles that allow you to open your mouth widely. The geniohyoid, this allows the jaw to come down. The mylohyoid, okay, this changes the elevation of the floor of your mouth so that you can swallow. And then the stylohyoid has some influence on the hyoid bone itself. We also have the infrahyoid group. Okay, so these hold the hyoid bone in place from below, and they allow the potential for the suprahyoid muscles to open the mouth. So we have 4 bones here: omohyoid, sternohyoid, thyrohyoid, and sternothyroid. Your pharynx contains 3 pairs of pharyngeal constrictors, and essentially these form like a funnel. And when a person is swallowing, this pushes food from the mouth into the esophagus. Then we have muscles that support the attachment of the cranium to the vertebral column and also support the attachment of the thoracic cage and the pectoral girdle to the vertebral column. Okay, and this allows the cranial bones to attach as well. So we can tip our head forward, that's called flexion. We can hold our head straight up, that is extension. We can move our head side to side, kind of in a tipping motion, and we can call that lateral flexion. And we can turn the head left and right. We talked about that with the motions of the atlas and axis joint for rotation. So this is a picture from a cadaver showing real muscles. We got the trapezius down here, kind of this fan-shaped one. Some of the longissimus muscles that are attaching through the neck into the trunk. And then we have the sternocleidomastoid and the semispinalis capitis up here. Okay, so these are some of the kind of thin sheet-like muscles that are providing for those motions of the head and neck. So now we're moving on to section 10.3, and we're going to be talking about the muscles of the trunk. In this section, we'll be talking about muscles related to respiration and how they can impact airflow into the body and also forcing air out of the body, and pressure within the abdomen. We'll be talking about the walls of the abdomen, the back, and the pelvic floor, and then the attachments, actions, and innervation of all of those muscles. So we can divide the muscles of the trunk up into 4 groups based on their general function. We have muscles that are involved in respiration. We have muscles that are involved in supporting the abdominal wall, muscles that support the vertebral column, and muscles that support the pelvic floor. And there is a little bit of overlap between these groups, but generally speaking, this is a really good way to divide the muscles up of the trunk because they pretty well divide into 4 discrete groups. So breathing requires us to use the muscles that enclose the thoracic cavity. So these muscles are the diaphragm, the internal intercostal muscles, the external intercostal muscles, and the innermost intercostal muscles. So we inspire when we bring in air and we expire when we push air out. There are some other muscles that can contribute to breathing. These include the sternocleidomastoid, the scalenes in the neck, pectoralis major, and then some of the muscles that we generally think of more as abdominal wall muscles, the internal and external obliques and transverse abdominis. So the diaphragm is actually a dome of muscles. It's found between the thoracic and the abdominal cavities. And the muscle fascicles here extend to a fibrous central tendon. So we have a central tendon in the center. Okay, so it's here we can see the central tendon, and then all the fibers extend to that central tendon. When it contracts, it flattens, and this enlarges the thoracic space, so it contracts downward. When you breathe in, you're almost sucking air in. And then when it relaxes, that's when we expire. So remember that there are 3 different groups of intercostal muscles. We have the external intercostals that elevate the ribs and expand that thoracic cavity. If you put your fingers kind of on your sides below your armpits and you take a deep breath in, these are the things that kind of expand and allow your ribs to move apart slightly. The internal intercostals are the things that allow your ribs to depress and retract. And then the innermost intercostals have the same function as the internals. Okay, so now we're going to talk about the muscles of the abdominal wall. So we have 4 major ones here. We have the external abdominal obliques. We have the internal abdominal obliques. We have the transverse abdominal and the rectus abdominal. So the external abdominal obliques, this is the outside layer. So if you're feeling on your belly, this is the layer that you can feel. And they keep your guts in, they keep your digestive system intact. They do have some role in breathing, not nearly as much as the muscles we just talked about, but they do have a little bit of a role in breathing. And they allow you to rotate at the waist. The internal abdominal obliques are a middle layer of muscles, and they're also involved in rotation at the waist. Transverse abdominals. This is the deepest layer of the muscles. These have horizontal fibers. Okay, so you can kind of see them here, the transverse abdominals. Okay, so your transverse abdominal is here. So these ones go like directly around your waist. These are the things that compress your abdominal contents, and they allow your vertebral column to have movement and flexibility. And finally, the rectus abdominis. Okay, so these ones are allowing motion of the vertebral column, particularly in the lumbar region where your lumbar vertebrae are, and they allow you to bend forward at the waist. Okay, so these are the ones that if somebody has been working out and low body fat, you can see as what we might call a six-pack. So these ones are, let's find them real quick, rectus abdominis here. So kind of here's 1, 2, 3 of what we would call a six-pack. And here, that rectus abdominis has been cut on this side so that you could potentially see what would lie beneath it. Moving on to the muscles of the back. Your back has a lot of flexibility in it. You can extend and rotate and flex around your vertebral column. Surprisingly flexible. And we have some superficial muscles in your back that you guys could probably identify from, if you've ever been to the gym and looked at the different weight machines and the pictures of what muscles those weight machines work. So you have your latissimus dorsi, we commonly call those your lats, and your trapezius muscle, which you might have heard of as your traps. And these allow for your shoulders to move. So these are the things that coordinate the muscles of the upper back with the muscles of the shoulder. So we just looked at some of the superficial muscles of the back. So the trapezius and the latissimus. These are things that are just beneath the skin and the subcutaneous layer of fat. So we can see these pretty easily. What we're talking about here are the deeper muscles. Okay, so we're going to talk about 4 deeper muscles. First, the erector spinalis runs vertically along the spine. Okay, and remember, it's on both sides. We are only showing it on this one side that's showing the deeper muscles. It's under the muscles that are pictured here. Okay, so that's your erector spinalis. Then we have the semispinalis thoracicus. Okay, so that's these that are kind of running slanted downward. Then your quadratus lumborum. Okay, so this one is in your lower back, and it's going to provide some stability between the vertebral column and the pelvis, and it also plays a little bit of a role in respiration. And finally, the multifidus, and your multifidus is here. Okay, so your multifidus is over here, and it's a stabilizing and a posture muscle. Okay, so now we're going to talk about the muscles of the pelvic floor. So your perineum is this diamond-shaped region that is kind of between the thighs. And we have the top is the urogenital triangle and the bottom is the anal triangle. So that's the anterior half and posterior half of the perineum. We have superficial muscles and then we have deeper muscles. And these are different between males and females. The anal triangle contains the external anal sphincter. That's what makes you, after you're potty trained, be able to use the bathroom when you choose to use the bathroom. And also the coccygeus muscles are important as well. Hernias are a pretty common condition, and we have 3 types. And in general, when a person has a hernia, some of the viscera, the internal organs, we might colloquially say the guts, come through a weak point in the abdominal wall. Okay, so we have an inguinal hernia. Women rarely have these, but they are the most common type of hernia, and this tells us that men are more likely to get hernias than women. And in this type, the viscera can push into the inguinal canal, or in extreme cases, all the way into the scrotum. We have hiatal hernias, where the stomach goes through the diaphragm and into the thorax. Okay, so we see this in people who are a little older and a little overweight. So if we have a tear in the diaphragm, we can see the stomach pushing up into that thoracic cavity. And finally, an umbilical hernia is where the viscera push through the navel or the belly button. And we're finishing up this video with section 10.4, where we're going to be talking about the muscles of the shoulder and the upper lip. So we're going to be talking about the names and locations of the muscles in the pectoral girdle, and then the shoulder, the elbow, the wrist, and the hand. We're going to talk about how those muscles relate to the joint movements that we talked about in chapter 9. And we're going to be talking about the innervation attachments and actions of the muscles. So we can describe the spaces between muscles, the separated muscles, where the layers of fascia connective tissue come between them as compartments. And each compartment has a related nerve and blood supply. Okay, so we can divide the muscles of the upper arm, of the upper limb, into anterior and posterior compartments. Okay, so we have this thick layer of connective tissue, the thick fascia, specifically called the intermuscular septa, that separates the posterior and anterior compartments. When something goes wrong with this compartmentalization, it can result in compartment syndrome. Okay, and then this is where the muscle or the blood supply to an entire compartment is injured. So compartment syndrome can be pretty serious. I had a girl on one of the track teams that I coached who had compartment syndrome, and it really it ended her senior season of running track. I remember that. It happens when a blood vessel is damaged and the entire compartment is therefore damaged as blood and fluid accumulate in that entire compartment. Because the fascia around these muscle compartments is pretty snug, there's not a lot of room for expansion. So when compartment syndrome causes increased pressure within that fascia, it's a painful thing. So when the blood flow to the compartment is obstructed by some sort of pressure on the circulatory system, within 2 to 4 hours, the nerves in that area can begin to die. And after just 6 hours, the muscle tissue begins to die. Okay, so nerves can regenerate after the pressure is relieved. Surprisingly, though, the muscle damage is permanent. A lot of times we think that those are flipped. So make sure you have those straight in your mind before the exam. Myoglobin is released from the damaged muscles and is removed from the body via the urine. So high levels of myoglobin in the urine is one of the diagnostic factors for compartment syndrome. If we need to treat compartment syndrome, one thing that we can do is called a fasciotomy, which is an incision into the fascia to remove the pressure in that compartment and immobilizing whatever limb is affected. So when we talk about the muscles of the shoulder and the upper limb, these are muscles that provide a wide range of actions. Some of them are very powerful. Think of throwing a baseball or doing a pull-up or rock climbing. Some of them are very fine. You use muscles of the upper arm when you play a lot of musical instruments. Okay, we have 4 different groupings of muscles here, and we're going to be talking about them a little bit separated so that we can organize them in our mind a little bit better. We have muscles that are involved with the scapula, are involved with the humerus and shoulder joints, that interact with the forearm and the elbow, and that are part of the wrist, hand, and fingers. Okay, so we know that the scapula is loosely attached to the thoracic cage, and this allows a lot of movement of your shoulders. We can rotate, elevate, depress, protract, retract. And the clavicle, your collarbone in the front of your upper chest, it moderates these movements. The anterior group, remember we said there's a posterior and an anterior group to your shoulders. Okay, so the anterior group, the pectoralis minor, is around ribs 3 through 5 and reaches to the coracoid process of the scapula, and it draws the scapula laterally. So this pulls your shoulder blades back. Okay, so we can see it here. You've got your sternum and your collarbone, and here your pectoralis minor. There's rib 3, 4, and 5, and this is the front of your body with your sternum. These are going to allow you to pull your shoulder blades back. Okay, and then your serratus anterior are here. Okay, your serratus anterior. Okay, so these are on the medial border of the scapula, and they draw your scapula forward for reaching or pushing. Okay, so now we're talking about the posterior group. We have 4 major muscles in the posterior group: the trapezius that we've talked about before, the levator scapulae. Okay, so that one is here, and it's a deeper one, right? Because deep is, we can see from the key of our diagram. The rhomboid minor. Okay, so that's going to be this one. It's kind of going also down, but in a different angle than your levator scapulae, and your rhomboid major, which is this larger one, more lower on the shoulder. Okay, and those are the posterior muscles of the pectoral girdle. Okay, so now we're talking about the joint at your shoulder. Okay, so the pectoralis major is really important here, this big fan-shaped muscle. Okay, and also the latissimus dorsi, and we've looked at the latissimus dorsi. On your back, this is kind of your whole middle section of your back. Pectoralis major and latissimus dorsi. Continuing on, we have 7 muscles with scapular attachments. Okay, so the first of those is the deltoid, which is kind of the top of your upper arm, the top of your shoulder. The teres major, which is here, kind of on where your armpit would be. The coracobrachialis, okay, so the coracobrachialis is the underside of your arm. And then we have 4 muscles that form the rotator cuff, okay, and we've got this little acronym, SITS muscles. Okay, so your supraspinatus, infraspinatus, teres minor, and subscapularis. Those are the 4 muscles that make up the rotator cuff. The supraspinatus tendon is the one that's easily damaged. Okay, so when somebody damages their rotator cuff, that is one of the ways that that could happen. Your elbow and your forearm can do lots of motions. They can flex in, they can extend, they can pronate and supinate, they can rotate inward and outward. And these are allowed by muscles of the brachium, of the arm, where your humerus is, and your antebrachium, your forearm. Okay, so the brachialis and the biceps brachii are the 2 muscles that are principally involved in flexing the elbow. And then the muscle primarily involved in extending the elbow is the triceps brachii. So your principal flexor is the brachialis. Okay, so that's right here, brachialis. And then you have two that are synergistic flexors, meaning they work together to give more power than either of them would have on their own. So your biceps brachii, which is the big one here, and your brachioradialis is here. Okay. And then your extensor we already talked about is the tricep, which is on the back of the arm. In the forearm, we have 5 muscles that are most important. Okay, so the brachioradialis, we talked about that one just a minute ago. Then the anconeus. Okay, so your anconeus is involved in extending the elbow. I don't believe it's in this picture here, so check out other pictures to see that one. The pronator quadratus. Okay, so that one is down closer to the wrist, the pronator quadratus. And then the pronator teres is closer to the elbow. Okay, and these allow in pronation. And then supination is by the supinator, not surprisingly there. So your biceps brachialis is going one direction and the supinator is going the other direction. All right, so now we're talking about the wrist and the hand. So we have extrinsic muscles and then intrinsic muscles. So extrinsic muscles are muscles that extend into the forearm. Intrinsic muscles are muscles that are contained in the hand themselves. The extrinsic muscles have actions that allow the wrist to extend and flex and allow the radial and ulnar flexion actions to happen. They also allow finger abduction and adduction, spreading apart your fingers and bringing them together, and also your thumb moving away from your fingers and back. We have the anterior compartment and the superficial layer there are the flexor carpi radialis, the flexor carpi ulnaris, the flexor digitorum superficialis, and the palmar longus. Then the anterior compartment, and this is the deep layer, we have the flexor digitorum profundus and the flexor pollicis longus. The posterior group, this allows for the fingers to extend and the wrist to adduct and abduct. Okay, so your wrist turning out and inward, kind of like a windshield wiper motion. And also for your thumb to extend and abduct. Okay, here brevis means short, ulnaris outside of the or on the ulnar side of the forearm. So use your keywords to help you remember what these muscles do. Okay, so in the superficial layer, we have several muscles, and then in the deep layer, we have several other muscles. And I know the picture is small. I'll let you guys look those up in the book. I think that'll be better than me trying to read them to you. Carpal tunnel syndrome is one of the problems that a person can have with their wrists. And it happens when the flexor retinaculum, okay, so that's this right here, the flexor retinaculum, it kind of fits like a bracelet under your skin. It's a fibrous sheet, and the flexor tendons pass under this, so it's got some protective qualities here. The carpal tunnel is literally a tight space between this fibrous sheet and the carpal bones. So when a person does prolonged repetitive motions like typing or texting or other repetitive things, The tissues in this very tight region can become swollen, inflamed, and fibrotic with scar tissue. And this can put pressure on the nerves, particularly you see the ulnar nerve is going through here, and the median nerve is also going through here. This can cause tingling and muscle weakness in the hand, and it may cause pain up to the shoulder. Okay, so the treatment for this is anti-inflammatory drugs like ibuprofen or Tylenol, immobilizing the wrist, and sometimes this flexor retinaculum can be removed or made more flexible with surgery. Okay, so now we're on to the intrinsic muscles of the hand, the muscles of the hand that are just part of the hand itself. We have the thenar group, and these make up the base of the thumb. We have the hypothenar group, okay, so that's the kind of expanded base of the little finger, and then the mid-palm group, which is the area in between those two.